Are you or a loved one scheduled for surgery and have a history of stroke? It's important to know that anesthesia is generally safe for patients with a stroke history, but there are some important considerations that need to be taken into account. In this video, we'll cover the key anesthetic considerations and best practices to ensure safe and effective anesthesia during surgical procedures for patients with a history of stroke. When preparing for anesthesia, it's important for the patient and their healthcare team to discuss the patient's medical history, including any past stroke events. This information will help the anesthesiologist tailor the anesthesia plan to the patient's specific needs. During the actual procedure, the anesthesiologist will closely monitor the patient's vital signs, including blood pressure, heart rate, and oxygen levels. They will also pay close attention to the patient's fluid and electrolyte balance, as well as any changes in their neurological status. Stroke patients may be at an increased risk of complications during anesthesia due to changes in their brain function and blood flow. That's why it's important for the anesthesiologist to carefully consider the type and dosage of anesthesia used. In addition, the anesthesiologist may use special equipment, such as transesophageal echocardiography, to monitor the patient's heart function during the procedure. After the procedure, the patient will be closely monitored in the recovery room. The healthcare team will watch for any signs of complications, such as bleeding or changes in neurological function. By working closely with the patient's healthcare team, anesthesiologists can help ensure safe and effective anesthesia for patients with a history of stroke during surgical procedures. For more information on anesthesia safety and best practices, please consult with your healthcare provider. Thanks for watching.